Let's Achieve Change is a podcast by Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. I propose to be that advocacy channel, making you aware, bringing the public more information on health and wellness topics, especially as it pertains to chronic pain and disabilities. I would like to be that voice for those silent sufferers out there who are not able to speak for themselves. If you'd like to know more about Let's Achieve Change, please visit our website at changeachieve.com or pamelagrove.com. If you'd like to be a speaker or you know someone else who wants to be a speaker, also visit the website and leave your email information and we will be in touch with you as soon as possible. Let's Achieve Change will air every 2 to 3 weeks, bringing you various topics on health and wellness and making the public more aware of issues that are not being discussed. We thank you very much for tuning in. Hello. Thank you for joining me today on Let's Achieve Change. I'm Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. Listen, if you want to make some changes, you have tuned into the right podcast. Now listen, don't forget to hit that notification button so that you can subscribe and you won't miss any future episodes on some changes you might want to make. Well, hello everyone. Welcome back to Let's Achieve Change. So excited. We are in episode 6 of season 3. And guess what? Today commemorates the year anniversary of Let's Achieve Change. If you have time, go back and look. We've gone through so many different issues. We dealt with untimely, delayed intervention. We've dealt with all types of autoimmune disorders. We have talked to so many caregivers and their perspectives on what they've gone through. We've talked about the overuse of steroids and post-traumatic arthritis. So there's so many episodes that you can go back and glean from. Please do that. But today we're going to go into another subject. We've been talking about patient advocacy for the last couple of weeks or so. And we wanted to just take a little bit more of a twist on that and deal with patients who are maybe terminally ill or having dementia or Alzheimer's. These are critical patients that need even more special attention of what type of care is provided in a timely manner. So definitely let's go into some of these issues. I have a special guest today, Robin Dill. She is definitely a specialist in the area of patient advocacy as well as respite care for dementia and Alzheimer's. So we're going to definitely get into her today. But before we bring her on, I do want to deal with a subject that she talked about, and she's going to talk about this a little bit more. And that is the issue on being assertive. So there's an article out there, and the article is written by International Medical I think it is, International Medical Aid, or I may be misquoting that, but we'll make sure that that's out there, International Medical Aid. And this article is talking about the value of assertiveness in health care settings. So, the rule, I guess I should say rule. I guess what I'm trying to say is the impression that most people have is that when people confront, they're being rude or they're being aggressive. So this article sort of talks about trying to bridge the gap between being too passive and being too aggressive and being able to effectively convey your concerns, express the right type of communication, whether it's from the patient perspective or you as a caregiver in the hospital settings or any other medical settings, to make sure that that patient is getting what he or she needs to have. So this is a very important topic. We're noticing that people who do not speak up, unfortunately so, do not get the attention sometimes they need, or decisions are made that should not be made. So today's topic is going over quite a bit of making the hard decisions. Robin will talk a little bit more about this in detail, being willing to come up and say what we need to say, being able to make those decisions, rightly so that we don't cause extra harm to our family members or patients if not necessary. Okay. Also, we're going to talk a little bit before I bring Robin on, talk a little bit more too about making sure that you are able to educate the workers and educate the different people who are on the care. There's so many people who don't know how to be effective in the communication with the patient, don't know about the actual diagnosis and all the details of the changes that occurred with those diagnoses. So these are things that need to be educated more readily, I should say, for lack of a better word. Okay. So without further ado, I'm going to bring on Robin so she can share her expertise. She has a lot more to share on the subject. Thank you. And here comes Robin. Well, hello there. Today we have Robin with us today. I'm so excited. Robin, how are you?
I am great. Pam, how are you?
I'm doing fine. Yes, ma'am. So Robin is going to first introduce herself, and she is going to come from a perspective of telling us her experiences in the healthcare system. Go ahead, Robin.
Well, I am a 21-year veteran of working in the field of dementia care. It started out personally with my mom and then went to a professional. In the past 20 years, plus I have been a professional caregiver in respite ministries, congregational respite ministry. I have come alongside hundreds of families whose loved ones have had dementia.
Okay.
Advocating for them. I've done a tiny bit of state advocacy with licensure back in 2007, 2008. I've done a lot of educating of caregivers through my own personal development of a caring for the caregiver and normal aging versus dementia, as well as served with the Rosalind Carter Institute for Caregiving with their Dealing with Dementia workshop and led those workshops.
Awesome. So now I'm going to interrupt you because you do come into the table with a lot of experience and a lot of things to add. So I want to make sure I'm zeroing in because there's so much I know you can talk about. So in serving in that capacity all those years, tell me whether you've seen any type of inconsistencies or unfair practices at all in the healthcare arena with that we can talk about.
Absolutely. I think the biggest glaring issue is the lack of education in our primary care doctors, even our neurologists.
Wow.
Where doctors don't understand the realm of dementia and what it means for a patient to go through behavior challenges, being able to cognitively understand communication, and the inconsistencies have given caregivers great distress.
Okay, so I'm going to cut you off there because this is very important. I want you to cite some specific examples, because I know you have many, of different families or yourself personally. What did they see that was inconsistent with neurologists or primary care physicians?
I'm going to start off with my mom's example. And I use this example in my training to say, my mom was a lung cancer survivor, and she started having memory issues. She started having falls. She started having lots of cognitive and physical issues. My dad went with her to their primary care doctor, who, without doing any tests whatsoever, made the diagnosis of Alzheimer's disease and immediately put her on Aricept.
Wow. Okay.
Immediately made her extremely ill.
Yeah.
And I would say 4 months later, mom had a major fall and went into the hospital. That's when they did the brain scan.
Wow.
She had a massive brain tumor.
Oh, my God. Oh, my goodness.
So that's my personal experience.
Wow. And that is so significant. That is so significant. You know what I mean?
It is. Because every time I talk with family members, I ask them, what is your loved one's diagnosis? And if they haven't gotten a diagnosis, I will say, you need to go through testing because number one, it may not be a dementia illness. It could be a brain tumor. It could be deficiencies in your thyroid or wherever.
Or B12 or something like that. And a lot of things. Yeah.
Exactly. So that's one. Other inconsistencies have been in our law enforcement, thinking that someone was just out of control.
Oh, talk about that. Talk about that, because I know.
Okay. So one of my participants had FTD.
Okay.
And FTD, frontal temporal disorder, behavior variant. Very impulsive, very erratic. Think of a teenage boy on steroids.
Okay.
And his wife would work and he would be left at home and he'd leave.
Yeah.
And so being picked up by the police.
Oh, no.
That this man is a danger when it was just something going on. Right.
Yeah.
And our law enforcement's lack of education. Now, I will say there is, through the Georgia Alzheimer's and Related Dementia Task Force, they have begun doing great training in our law enforcement and our healthcare community. That started probably back in 2000, 2008. Renee Unterman got that GUARD group going. And it was for education and advocacies.
So let me ask you something. So you said that got started in 2008. So is that something that's statewide for Georgia?
It is. And from that, there has become memory assessment clinics around the state that can help someone to go and get tested. They're called MACs.
That's important. Memory assessment clinics. Okay. And how would somebody get in touch to get connected with that operation? How would they get in touch with that group?
I would Google GUARD and find out. My phone is dead, or I would look it up right now. Or they could Google memory assessment clinics, MACs.
I want you to say that a couple of times because people are going to be listening. They're going to Google, say it again.
Memory access clinics. Or GUARD, GARD. And that's the Georgia Alzheimer's and Related Dementias.
That's important information. So that gentleman who had the FTD, was there any specific things that happened when he was picked up at all that was very negligent?
Well, it was just how he was treated. And this has been an issue. There was another incident. I don't know the specifics of it, Pamela, but it was in Atlanta. And it was multiple times this guy was picked up, arrested, picked up and arrested. And it was not because he was a criminal. It was because he had FTD.
Wow.
And that's my thing with families. One of my issues is families' lack of education. It's education all around. It's our healthcare. It's our law enforcement. It's our families choosing not to get educated about their loved ones' conditions.
I think part of it, and you correct me if I'm wrong, but I think part of that is that people don't want to accept it.
Exactly. Exactly. And whether that's grief, Pamela, or ignorance.
Combination probably of both. Combination of both. Because lots of the time I've seen people try to ignore, especially something that they know is a stigma in their mind. Mind. Not to say that it is, but.
So another situation happened with one of my participants. He had advanced dementia. Went into the hospital for a health-related issue with his digestive system. He was in the hospital several days and he was literally dying.
Oh, wow.
And the physician whose care he was under in the hospital kept ordering more and more tests. And I was able to meet with the family, ask them to pull together the palliative care team and have a conversation about allowing this man to die with dignity. And not throw one more test, one more. I mean, it was like, let me just pay for your house this month, you know? Because that to me goes along with hospice. When families are at a point where they understand that there is no longer curative opportunities for their loved ones. And for doctors to say, okay, we're going to go the hospice route. And that was one of the things that I wrote down was the lack of understanding about hospice.
And I think too, families have to become more proactive. And I know I'm guilty as well in having something in writing, because that carries more weight, even with the physicians, to have something in writing and say, this is my mother or my father, my brother, whoever's wishes. That if they ever got to this point. This is
advanced directives. We need that healthcare power of attorney. We need that financial power of attorney. And that's part of my training, is to say to families, you need to have your affairs in order. You need to have those documents so that if you were to go into the hospital, and you have to have a healthcare agent that will be willing to do the hard things, to be willing to say, we're going to disconnect life support. Because I have been at the bedside, Pamela, of families that have not talked. And so they're in ICU. Mom is brain dead. And they can't make the decision to disconnect her from life support.
And there's nothing in writing.
And there's nothing in writing. There's been no conversation. And it is the most painful journey to walk with somebody.
So give me an example of, and I know you probably had this happen more than one time, and give me an example of something like that. And how did it turn out? How did it finally get resolved? What was the resolution with that situation? Give me an example.
Well, it was in that particular situation, it took time. It took more time than it should have because nobody could make a decision.
So who finally made the decision? A family member? Who made the decision?
I think with a social worker, they sat down and said, this is the situation, and your mother is not going to recover. She's brain dead. So social worker coming alongside, sitting down with a family and saying, this is the situation.
I got you. But in that situation too, like you said, it took more time. So now we had mom going through more harm than she needed to go through, and family going
more
through
trauma.
More trauma.
More emotional trauma.
More emotional.
The
family going through as well. And more financial burden. More financial burden as well.
Absolutely.
That's a good point. Okay. So basically what you're saying to me, because I got to sum up some things. You're saying to me, if you had all the money and all the power in the world and you had the authority and say, okay, Robin, you make the decision. Your first thing would be to educate.
Absolutely. Education is power.
Right.
And if we could take the time to understand, to face that we are aging. I'm aging. And to say, what do I need to have in place? There's a great elder attorney in Atlanta who I use his things to be prepared for sheet, and I pass it out at all my trainings. These are the documents you need. These are the things. I have a friend that just went through, her dad is in hospice care, and all of his finances were scattered. They owned property here and trust here, and it was just all out of control. So looking at what do I need to do for my children and my grandchildren and for my spouse? What can I do to make decisions now so that when I am in a place where I can no longer vocally make decisions, I have an advocate that can say, this is her wishes. There's a great personal preference sheet of what I like and what I don't like. And I say to people, one day you may be taken care of by somebody.
That's right.
And they need to know you and not them, because if I'm going to care for somebody, I'm going to treat them like me. But if they don't have my same likes, and I'm going to fail in that giving situation.
Exactly.
So in this realm, other failures that have happened have been in caregiving. Bringing in someone in your home that you have heard, well, she will sit with your loved one, but they're not trained. And so let's say somebody comes in to sit with mom and she falls in your home. She's not licensed and bonded. And so you can be raked over the coals financially because you didn't have a contract with that person.
And they're not from an agency or anything as well. They're not from an agency.
That's right. So I advocate use an agency that's licensed and bonded that says you've been trained in dementia care so that you're not getting someone that has no idea what to do if somebody pulls their clothes off and heads out the door. What are you going to do with them?
Exactly. Okay. Sounds good. Okay. So basically, we've given I'm going to sum up. So basically, more education with the primary care, neurologists, law enforcement, caregivers. Okay. Let's get some more definitive actions as far as advanced directives, as far as healthcare proxies, right?
Learning about hospice and palliative care.
And then there are agencies that people can reach out for assistance with, the GUARD, and you said the MAX, right?
The MAX and our area agencies on aging. They all have a dementia specialist. So they could reach out to whatever area agency on aging is in their particular county and call them and ask for a dementia specialist.
Okay. Also, you mentioned a healthcare agent. So somebody, is that different? A healthcare agent, you said, who can make the hard decisions, who's not so emotionally involved? Like
that's who you appoint. That could be
a family member, you thinking?
It could be a family member. It could be an attorney. It could be your pastor. It could be your doctor. It's somebody that would be able to make hard decisions and not let their emotions guide them. It's your wishes, somebody that would uphold your wishes.
Okay, that sounds good. Okay. Any other resources for navigate? You've given us quite a few. Any other ones that you can think of that might be necessary to navigate for dementia issues or handling those who have that diagnosis?
Always the Alzheimer's Association, to call them, and all of the different types of dementia have agencies that are connected, like FTD, Lewy body, vascular dementia. They can, Google is a great tool to look for those types of places and those kind of resources. The Rosalind Carter Institute for Caregiving, they offer help in that respect. They can be a resource. Caregiver.com. Is a great resource.
Okay. That sounds good. That sounds really good. Because I just want to make sure that people have some type of plan that they can execute. And I think when you said when they get emotional, they're not making a hard decision. So if they have a little bit more information in front of them, I think this will help for a lot of people. You understand?
Absolutely.
I think so. Yeah. Okay. Anything else that you think you might want to add? You've given us a lot.
One thing that I was thinking about in thinking back over my time at the respite ministry was when caregivers tried to use their long-term care insurance.
Okay.
And for being able to navigate through long-term care and looking for the documentation that could support, say, a program like a congregational respite ministry that wasn't licensed.
Okay.
And why would they not want to pay for something that is keeping that person out of long-term care?
Okay.
It's a benefit. These care places, these day programs actually can improve health. They can keep them stable because they're getting activities. They're being stimulated rather than being at home. So to be able to navigate the long-term care and to help them understand these are valid programs. And
so not to interrupt you, but I got to make sure I'm understanding because the audience won't understand as well. So the person's long-term insurance will cover the people going to these daycare programs?
They can. They absolutely can.
Okay.
And when someone is in like a congregational respite versus an adult daycare, the difference is one is licensed and one isn't. Okay. However, it's like preschool and Mother's Morning Out.
I got you.
Okay. So Mother's Morning Out offers respite to moms.
Okay.
Congregational respite offers respite for caregivers.
Okay.
They may not be at the point where they need a nurse and the therapies that an adult day health program would offer.
Okay.
But where they are in a respite program could absolutely support that family and give that caregiver a break.
This is good information. This is really good. This is really good. Okay. And you said that they have to just check into their long-term health insurance.
If they have a long-term care policy to see if they would pay for that.
Okay. Okay. Sounds
and
good.
those are those policies that you pay for. You probably take them out when you're in your 40s and you pay on them. And, my mom and dad both had long-term care policies. Were they utilized to the max? Absolutely not.
I bet they were. Yeah. I bet they were. Yeah. Okay. Excellent. I think we got it. I think you covered. You were so thorough. You were right to it.
I got one more scenario.
Okay, go ahead.
This is another personal scenario.
Okay, go ahead.
My mother-in-law had a bleed.
Okay.
In Panama City.
Okay.
She had a hemorrhage in her liver.
Wow. Okay.
Goes to the hospital, goes into ICU, and while she's in ICU, she has a heart attack.
Oh, Jesus. Okay.
She is in a small regional hospital that was not equipped for her medical condition.
Exactly. Okay.
We worked for a week, Pamela, to get her med flight up to Atlanta out of Panama City. And so the disparagement of small hospitals not releasing a patient, not advocating for that patient, understanding they can't do anything. You're not going to have a heart surgery. You're not going to be able to deal with any of that.
Yeah.
Release that patient. So
it was just maybe a pride issue of that hospital.
We don't know. I know that I'm on a billboard because I use my assertive communication skills.
Oh my God.
And my sister-in-law did to get her busted out of that hospital.
Oh my heavens.
It was a week of trauma for all of us.
Oh wow.
Trying to get her out and get her life flighted so she could go to St. Joe's. I'm just saying, if you are in a situation and you are not getting your needs met by the medical community, use assertive communication skills. Yes. And if you're not getting an answer, go to the next one. the next in line. Go up to the hospital administrator. Go to the very top and say, this is not acceptable.
Exactly. Yeah.
And if you're in a care facility, go to the administrator or go to your ombudsman and report that there are issues in the care that their loved ones are getting.
Yeah. You're the second person that mentioned that. I just interviewed another person and she mentioned about the ombudsman as well.
The ombudsman, yes.
She mentioned that as well too, because her sister was diagnosed, she had MS. And then she started having some memory issues. And we talked about that a lot too as well. So, yeah. Okay. Awesome. You're always great. You're always great. I thank you so much for coming on. I think you're such a blessing.
Well, I don't know if I was a help, but
yes, you were. Yeah. Because the whole issue about this whole season is, let's talk about these things that's going on and let's try to get some resolution for people. Let's try to get people some tangible information that they can avoid a lot of hurt and harm to each other and their loved ones. And that's what the season is about. So,
and I want to say one other thing, Pamela.
Yeah.
If you have a loved one that has a medical diagnosis that causes them to be hospitalized and they have dementia, they should never be left alone in the hospital by themselves.
I agree. I totally agree.
I could yell that at caregivers. And can I tell you that caregivers still say, well, the nurses got them.
Yeah.
And it's like, no, they don't. They are short-staffed. And they don't have them in the middle of the night when your loved one decides they're going to rip out their IV and take a stroll through the hospital and go into people's rooms.
Exactly right. Yeah. I've seen it over and over again. It
drives me bananas.
Yeah.
So,
okay. Thank you so much.
Soapbox, educate, and don't leave your loved ones alone.
Yeah. Got you. All right, girl. Thank you for coming on. Okay.
You're welcome.
Until next time. All right.
God's blessed.
Love you too. Bye-bye.
Bye-bye.
Okay, so we're going to thank Robin for coming on. Robin, thank you so much for all that you do. I want to just kind of tidy things up and kind of consolidate some of the things that was talked about. So educate, right? Making sure that we're educating workers, we're educating those who have access to our patients and our family members. Secondly, advocate. Don't be afraid or feel that you're in the wrong, to be assertive, to making sure certain things are being done in a rightly manner. Thirdly is delegate, learning how to delegate some of the care to others, but making sure the people that you're delegating that care to, those people are trained and they do have the right information of how to provide the services that they need to provide. So I'm going to also go over some of the resources that Robin made sure that she left out there, because I think some of these things are important. So there's an article, the article I mentioned about the value of assertiveness. Make sure we go to that. That's at International Medical Aid. That's the name of that article, Value of Assertiveness. The other article is about palliative care and hospice care, knowing the difference between that and how to assess when that's necessary. It's out there on National Institute on Aging. That's important to check that out. Also, being aware that you can access the Alzheimer's Association for community resources. Also know that you can go to your local Alzheimer's Association chapter, your National Institute on Aging in your area. You can seek out elder care locators. So these are different resources and there's different things that you can do to make sure you're able to better take care of your loved ones at home as long as you can. And also to please be aware of the fact that there's nothing wrong with respite. So just making sure that the respite care you seek is definitely providing the services that you want it to provide. And as Robin mentioned, check into your long-term health insurance and make sure you know what it's going to provide. And once again, I thank you so much for tuning in for this past year. Continue to tune in. We got lots and lots of more to still cover. And until next time, I'll talk to you soon. Bye-bye. Thank you for tuning in today at Let's Achieve Change. Don't forget to like, share, and subscribe. You will find out more about Metanoia Education and Wellness Center on our website at changeachieve.com. We welcome your questions and your feedback. Please feel free to fill out the form on the website and we will contact you directly. I pray that you prosper and be in good health, even as your soul prospers. Remember, it's all about the change. Thank you.